a name that tune, a craft hour, a women's group. And then, like I said, we've been doing this since March. So we've been doing an happy hour every Friday since March. So when we bring on different acts and we bring on a different information regarding COVID, regarding disability, regarding whatever it is. Like this week we had, we talked about uh, uh, when it came to when you buy stuff, through the internet, identity theft, fraud, the signs to look for. So we've been doing those different uh, virtual groups, and right now I'm thank you very much for inviting us, and we're just looking for different ideas to continue our efforts to to serve our individuals. Thank you.
And
I'm Diane. Go ahead. I'm Diana Clanton, and I'm the Independent Living Coordinator for the Skill Office. I'm an outreach. There's several other outreach offices. What we have done is they divided up our customers' list and gave us each a list. And we called them to see how they are, did a couple of surveys, trying to get the state to give us some grants to get our people that's got HCBS services tablets or something so they can do the social. Because I live in a rural area and it's really rural. My customers don't have internet. They don't have any of the, tablets or anything like that. They just have a little flip phone that they can talk on. Yeah. So I'm really rural, but we cover a lot of different counties. I've got a lot out west of me, like in Norton, Kansas. I'm in Sedan, Kansas. I'm about 200 miles east of Wichita, Kansas. So, but we've done surveys and we talk to them however long they want to talk to us about anything that they want to talk about because they are isolated.
Hi, my name is Todd Holloway. I'm light-skinned, graying brown hair, a red shirt, and I work for an independent living center. My pronouns are he, him, and his. And here in Washington State, one of the biggest questions and concerns I had beyond the things that we're doing for our folks in our independent living center, I'm also the chair of the Nickel Emergency Planning Subcommittee, and with the vaccine rollout, I'm having some concerns about Walgreens and CVS being able to get delivery to nursing homes in very remote areas. So if we go down that path in the conversation today, I'd love to connect with people who may have some solutions in mind for that. Beyond that, a lot of the work we're doing is similar to what I've heard here on the call today with having as much remote contact as possible so that we keep in contact with folks. We did have one in-person, one participant at a time be able to come to our office to pick up Christmas gifts that were things that we were able to get from World Vision and the food pantry and other donations from our local community. We've been involved with food delivery, medication delivery, and other things like other centers, and that's been a real big help for folks. Transportation, as you know, is a nightmare, not only in the cities, but it's near impossible once you get outside of the metropolitan area. So I think that one of my main concerns right now is getting people out of institutions as quickly as possible. So our fifth core service is really being strained. We have extra help thanks to CARES Act dollars to be able to try and get people out of institutions, but the housing situation here is as bad as it is everywhere else. Kansas, I hear, is doing some great stuff. Amy, I talked to not long ago, and she was on one of our calls, is doing great stuff in Kansas to get people out of facilities and into hotels and other transitional housing. That kind of thing may save people's lives, and the more I can learn from that and do the same thing here in Washington, the more we'd like to continue doing that. I really am grateful for all of you getting together to have this conversation today, because the difference it makes literally will probably save some people's lives.
Thank you, Todd. I think I'd like to pause because Todd had a lot of great comments, and then there were a couple of questions I'd like to throw out to the group that he brought up. Are folks doing, or what are folks doing around vaccine rollout? He was asking if folks had solutions for some of those rural areas getting access. And then the other question I heard was, what are folks doing around nursing home transition? If anybody has thoughts on that. And then we'll move forward with check-ins. But any thoughts on his questions?
This is Maya with Northwest Georgia Center for Independent Living in Rome, Georgia, serving Northwest Georgia. Read the transition question. The challenge we have, and I imagine it's elsewhere, is that at no time have any of our nursing facilities been out of lockdown, and we cannot go into them. And the relationship between us and social workers, many of whom are new now and who are strained to the max, trying to deal with everything, including COVID, is thin at best. So one thing that we have done is we sent, first, we made sure our list was completely updated, and we had a staff person attempt to contact every social worker in our area and verify that we had correct information. And then we sent a letter of appreciation thanking them. I mean, I know from personal experience that social workers are people. Some are terrible, some are fantastic. So, but they're there, they're working. So this is something. So we sent them a letter of appreciation. We sent them our brochures again. We've sent offers to do Zoom presentations, everything, because unfortunately we can't get through to the residents unless they contact us. And so that's a real tough thing. We've done some transitions, not MFP, except I think one at the beginning, because certain requirements for MFP have changed around here. So in housing, what's that? But we too have, we found hotels, we found smaller, roommate situations. It really takes digging, but we're reaching out to the staff at the nursing facility to see if there are any relationships that can be established so that we can reach out to more people. Thank you.
Thanks, Maya. Go ahead, Julia. Julia, go ahead.
Oh, hi. Hi, Maya. I love Rome, Georgia. This is Julia Sane. I'm the executive director of Disability Rights and Resources in Charlotte, North Carolina. I'm a 65-year-old Caucasian female with short salt and pepper hair. My pronouns are she and her. And here's what I would have to say about going back to working with our consumers and our staff and so forth. The one thing that is in need for a lot of people that are in our community is just talking to somebody. And I know personally as an executive director that when I try to reach out to other organizations, even if it's just me personally trying to call somewhere, I feel ignored so much, and they're feeling ignored. And so one of the things the staff is becoming more and more aware of is you talk to somebody and listen to somebody as long as they need you to. And you can say to them, if it would normally not be this way, and I know consumer control, so we don't call them, they call us kind of stuff, but that's all kind of gone out the window. And if you're talking to someone on the phone and if they say something like, oh, you know, nobody ever listens to me, or I haven't had a chance to talk to anybody, say, well, you know what? I'd like to call you back in a few days if that would be okay. You still get consumer control, you still get permission. It's not like I'm your mom and I'm calling you. But my staff is finding, and I've told them for years, that we're not about quantity, we're about quality. But how many people say you're the only place that answers the phone, you're the only place that has let me talk? And people cry on the phone because we say we're in no hurry. You just take your time and you can call me anytime you want to. And I think as we get past the holidays, it's going to be so much worse because people get kind of, even this time of year, this year they're going to get adrenaline rush and be kind of positive during the holidays, and then January and February is going to be bad. So it's our way of doing business is that, you know, I don't mind, I'm tickled to talk to you. What do you want to talk about? Anything, you just let me know. The other thing I will say when it comes to nursing home transition, nursing homes are sort of like Hotel California. You can check in anytime you like, but you can never leave. Nobody's going to leave. And for you babies, you'll need to Google that. But nobody is leaving in a nursing home because nobody wants to take somebody who's been in a nursing home. And so our focus right now is we want to do diversion. And we have taken all the energy we were spending on transition that we will spend on transition again someday, and we're focusing it on diversion. Don't go in there. Don't go in there. What would it take for you not to go in there? And we are now partnering with, instead of, I heard what you said from Rome, and I absolutely think that's a great idea about calling the social workers and so forth. We sort of did it backwards maybe from that. We contacted the shelters and we said, we don't want you to put anybody in a nursing home that has a disability. What would it take for you not to do that? Because we know that sometimes the shelters is the stop on the route before they get to a nursing home. So we want to stop it there. And one of our shelters has bought an old motel and is putting people in that old hotel and motel. And so we are sponsoring people through the Salvation Army that are in the motel, saying you're not going to leave the motel. As long as we have money to help you, you are not going to have to leave the motel. The stress that takes off people's lives. We have one person that is staying in a uptown, in-town suites kind of place, and we can pay them by the month because they are on a list, and as soon as that place is ready, they're going to get housed. But where do they go in the meantime? And we have said, you're not going anywhere. You're not going anywhere. You're fine. You're going to stay here. We're going to keep you here. It's huge for their mental health that way. So that's what I had to say is we're partnering with the shelters. And then also the other one is we contacted our local mental health association, which is also a nonprofit. And we have partnered together to set up pro bono video mental health counseling professionals who are going to be providing people an opportunity for free mental health counseling. And I'm using, Kimberly's wanting to know what funding we're using. We're using our CARES Act funds. So that's where we are right now. Today, it's a Wednesday. It could change tomorrow.
Thank you. Go ahead, Amber.
Hi, it's Amber from Wyoming Independent Living. I just wanted to share a little bit about what we've been doing over the last 6 to 9 months. We received CARES Act funding as well. And initially we had used some of that funding to purchase iPads for those that were going to need some telehealth access. as well as some of our offerings at our center that we were switching to virtual. We've also purchased PPE, and we've been getting that out to any consumers that needed that. All of our groups have gone online so that they can stay connected. We have peer support group that we meet every week. We have a individual advocacy group. We have a systemic advocacy group. Those are all continuing to meet regularly throughout the month. As far as our nursing home transitions, when COVID hit, we had been contracted with Medicaid, our state Medicaid, for nursing home transition services for years. And in Wyoming, we had been impacted quite a bit in our energy sector, and our state funds were cut along with our nursing home transition program. So what we did was switch our CARES Act funding to our nursing home transitions, or some of it. What I was wondering, though, from the group is if anybody is providing any workshops that are focused on mental health, just kind of like healthy community living, but more for the mental health sector from a peer's perspective. I had taken a look at the WRAP program from Copeland Center, and I wondered if that might be an option, but I was also just wondering what other CILs are utilizing. We do offer quite a few workshops at Youth Leadership Academy. We've done an annual conference that was virtual this year, and we thought that this would be a good opportunity to utilize some of our CARES Act funding to put a mental health workshop together.
Thanks, Amber. Also, Kimberly Mick was wondering if you were planning on getting the iPads returned or if they're the consumers to keep.
We are, so we've been kind of doing that in a couple different ways. We did loan out iPads to those that were wanting to participate in our groups or in our conference. So those were on loan, but also as an opportunity to provide some skills training and connect them with our state AT program to get technology that would be suitable to their needs. So I hope that answers the question. So they are on loan, but we do have quite a bit of CARES Act funding still left and are looking at the possibility of helping people purchase their own technology with that.
Thanks, Amber. So just to circle back, so Amber is wondering if anybody has thoughts on mental health groups, especially during this kind of holiday / COVID run-in season, what folks are doing in that area.
It's Darius from Access Living in Chicago. I highly recommend the WRAP program. At some point, I don't think actually, so thank you for reminding about this. I don't think we actually provide this right now virtually, but we had actually a volunteer, somebody who was trained and has a lot of experience doing this. So if anyone is interested, I would recommend to reach to NAMI. They might connect you with somebody who got the training and knows what they're talking about. However, I want to also sort of caution people. I don't know how to even phrase it, because it's lovely what Julia was saying, I'm sorry, about, following up with people and the idea that, we are the only ones who are really picking up the phones and talking with them. I notice with some of our staff that I used to manage in the past that we try to help people so much that we attempt to do clinical work without proper, licenses, proper preparation and things like that. And it turned at some point into people calling us with suicidal thoughts and things like that. So first of all, definitely talk within your agencies if you don't have a procedure what to do in such situation if a consumer contacting you. with suicidal ideations, but also caution your staff and just, word of caution to you, try not to become a clinician. People need professional services. We can support them, in addition, but definitely refer them to people who are trained doing this.
Yeah, Todd?
Yeah, in the state of Washington, we've had really good response in the past from peer support when it comes to mental health and behavioral health as well. If you're a state that received any of the FEMA money, I know that there was somebody had in the chat, I just haven't been able to keep up. There was a question about FEMA, and FEMA has dumped a substantial amount of money into certain states to help with crisis counseling around this time. I know in Washington, we have Washington Listens, and I'm guessing that's probably where the bulk of that money went, was dumped into the mainstream mental health organizations within the states. But I know they created that. I don't know enough detail about Washington Listens to really say whether it's a great thing or not. I know I hear great things about RAP, and I'd like to learn more, because I'm in agreement with all of you that the amount of crisis counseling that is going to be needed and is needed right now is going unrecognized. I think this is something that those of you who are spending hours and hours on the phone with people, you're probably keeping those people out of institutions as well. So any ideas along those lines, I would love to not only hear from you, but also maybe do some research and find out more if some of that money that has been distributed is actually going to the people who need it.
Thanks, Todd. And as always, great transition. I was actually going to double back to the chat, talking about FEMA money. We have a question from Misty. Has anybody been successful in getting any FEMA reimbursements for some of your congregate setting relocation efforts?
This is Todd again, and I would really be surprised if people did. FEMA has been extremely rigid with their individual assistance and public assistance in that regard. We've been pushing them and prodding them for months now through the Partnership and Inclusive Disaster Strategies, as well as the NICL Emergency Planning Subcommittee. That's some deep pockets that really need to step up to the plate and help with this issue. I don't know the answer there. We keep approaching them and not getting the kind of responses that we want. But again, I'm happy to point people in the direction of Marcy Roth, who is also an independent living a veteran who is now with World Institute on Disability, but was the Office of Disability Integration and Coordination leader at FEMA at one point. She knows how FEMA works internally very, very well. That if everybody on this call joined with everybody on that partnership call, we might be able to get them to move, but we haven't been able to get them to budge. It seems like sheltered workshops are somehow on the list for getting reimbursement, but Centers for Independent Living are not. It makes no sense to me whatsoever.
Thanks, Todd. Any other thoughts on what's been asked before, or new moving forward questions and thoughts you have?
Mary, if I could again, this is Amber with Wyoming Independent Living. I appreciate the feedback on the RAP program and definitely looking into that one. And I did send an email to get a little more information. Can any of you that are using the RAP program tell me if it's fully accessible or if it's a good one to do virtually?
So Carrie Rostron in the chat has offered her email to you, and she says that she is currently doing the RAP program over Zoom if need be. I'm not
Okay,
sure
thank you.
if that answers. Carrie, do you know if it's accessible?
This is Carrie from Options in Logan, Utah. It has been for me. Um, I used it a lot. I learned about RAP and became a facilitator when I lived in California. Now I'm in Utah, but I've used it for people with disabilities. I've used it for mental health issues. I've used it with veterans. It's a pretty easy program once you get the material and get the training and stuff. It's amazing. It can be used for so many different things.
Thank you, Carrie.
Great. I also just wanted to add on to what Todd was saying about some of the advocacy efforts going on around nursing home transition. Misty Dion has dropped in the chat a link for advocacy around relocation efforts for long-term care facility residents to get the relief we need in the next COVID-19 relief package. And there is a link to that Google Doc to learn more about those efforts. Again, what we'll do is we'll try to save the chat and compile it all. And we'll have it sent back out on the emails with the transcripts. We also have lots of info in the chat. People are dropping in their different social groups that they're offering and different programs they're offering via Zoom. And some of those folks have offered that if any of your consumers or if you would like to join, you could do that as well. And those are in the chat, and we'll save them and pull them forward. I also have Herschel Jackson is wondering, has anybody had luck with deaf outreach during COVID, and what does that look like?
This is Beth from Tennessee, and we serve a large deaf community because we also offer ASL interpreting services. So we have reached out to our deaf community. We're doing a lot of things over Zoom. We're doing a lot of video phone calls, check-ins, and a lot of texting with our deaf community.
Thank you. Great. Anybody else? Any thoughts or questions for your peers on COVID-19 related?
Yeah, this is Todd. When it comes our work that we're doing with the deaf community, fortunately, we have a really good relationship here in the state with our Department of Health, and we have a disability equity person who was just hired, which turned out to be really, really advantageous. We've been creating ASL and captioned videos for the deaf and deafblind community. Has been a really, really tough reach. We have a large population, as Kimberly Meck will tell you, in the Seattle area of people who are deafblind, and trying to get information about COVID testing and flu vaccines, and now, of course, with COVID-19 vaccine, reaching folks is we knew was going to be a challenge, but the relationship that we have built with our Department of Health has made that extremely better and faster. So I would recommend that if you have any relationship at all with public health in your community, to reach out to them. They have deeper pockets than we do, and they can help a great deal with that. Jim House, who is a deaf individual himself, is the lead for our state coalition, and he has worked very closely with Steve Peck with the Office of Deaf and Hard of Hearing, and they've created a lot of really good materials. I wish I had them at my fingertips to throw them in the chat, but what I can do is offer them in some way, shape, or form. I'll put our SILC, State Independent Living Council website, and our Coalition on Inclusive Emergency Planning website in the chat. If anybody wants to connect with Jim, he has friends at the FCC even. They do a lot of great work.
Thanks, Todd. That's one of the wonderful parts of these meetings, is we can share resources in instant time. I also just wanted to add, there were a few others in the chat. Jeanette Lanterman from DAC Reading, they wanted to circle back to the mental health. They've been trained for something called mental health first aids, or aiders at DAP in order to look and listen for signs of crisis and how to implement resources in order to assist our clients with mental health issues outside of our scope. It's mentalhealthfirstaid.org. Thank you, that's a great resource. Yes. Great. Any other questions, thoughts? This has been also, can I just say, this first 40 minutes, it has been already so informative, and I'm loving seeing all the resources being shared. So thank you everybody for being willing. Anybody else want to share or have questions?
Yep. This is Maya with Northwest Georgia again. And regarding mental health and reaching people, we are fortunate to have someone who is very active in NAMI on our board. And we have a staff member who belongs to several mental health related groups in our area. And several of us staff have mental health issues. So we have found that within our community, we have two issues. One is I think we're down to one or two in the entire area that mental health professionals who are licensed clinical psychologists or psychiatrists. So that makes it quite a challenge. A lot of the people don't want to do virtual with strangers, but they'll do it with us, which is really cool. And whenever we talk to somebody, our first sentence out of our mouth is, look, we're not a psychiatrist. We can't prescribe your meds, but as peer supports, we have huge peer support groups. Well, we have a lot of peer support groups, but this leads to another issue. During the years preceding COVID, we have become more and more involved in our community with the prison reentry initiative, with people who are unhoused, people who have substance use issues. And so we've been working less with the shelters, but more with the day centers for people and helping provide food during COVID. And I'm hoping that when the vaccines hit our area, we'll be in a position to help be sure that a very marginalized population will be able to also be served with vaccines, and that we'll be able to work with them. So we're doing our best with nobody professional around in that sense, but we're doing a great job that way. So it's one way to go. Thank you.
Mary?
Yeah, Kathy, go ahead.
Yes. Hey, how are you? Thank you for doing this. We need to do this more often, okay? This is Kathy Baker from Rome, Georgia. Maya is my executive director, so she's on this call, and this is live, folks. So anyway, we do the peer support groups, but like Julia was saying, I think the one-on-one conversations that I'm actually participating in with the people that call in that need help are the most effective. I know to me they are. So I will just leave that out there for anybody to take it like they need to, okay? Thanks, Mary.
Thanks, Kathy. There's also a lot of great resources being dropped in the chat. Again, we'll work on getting those together. Sydney says their staff is trained in QPR to handle situations where our consumers are struggling with mental health. There's some great, the deaf and hard of hearing and the deaf blind work links that Todd promised are also in the chat. And I think, Talmage, were you trying to speak? No. Sorry, I thought I saw you unmuting. All right, great. I just wanted to circle back. I apologize if I've missed anybody's questions in the chat. I'm trying to follow as best I can. There was one way up at the top asking about, is anybody else having any success with relocation or diversion using hotels or motels in their area? And what does that look like?
Hi, this is Ms. Dion from Road to Freedom Center for Independent Living in Williamsport, Pennsylvania. We have been successful at relocating individuals both from group homes and from long-term nursing facilities to hotels through the use of our COVID funds. We're finding great success in it. It's allowing individuals to have more control over the amount of people, care providers, interacting with them. We're able to supply them with PPE that's needed, home health meals, personal attendant services, and skilled nursing if needed. But I would say that relocation efforts using hotels and motels have been very successful, and I encourage, all CILs who have COVID funds to sort of take that route if possible. And I'd be willing to help assist any other CILs in sort of understanding. We have a flow chart that we can share on how that might be able to be useful for you.
Thanks, Misty. I think that'd be great if you don't mind sending like a flow chart to me even. This is Mary. I'd be happy to add it in the resources that come out. Also, Cheryl Simpson says, using care funds, they were able to do some motel stays for some diversion for homeless with disabilities that did not qualify for the CSB motel hotel assistance during COVID. And there was another question up at the top of the chat around that, kind of just asking, some folks are still trying to figure out what to do with their CARES funding. Any other ideas on what are folks using that for? So a two-parter. Go ahead.
This is Todd. In Washington State, we did just have a very successful 4-module training from the partners with partners in disaster strategies, or for disaster strategies, inclusive disaster strategies, that culminated with a 2-day conference. I put that link in the chat for the newsletter from our state that talks about that. And at the end of that link, there's also a link to the partnership website. They can actually work with you to come into the state using CARES Act dollars to work with all the CILs. What they did in Washington was work with all the CILs to create continuity of operations plans. We all did a gaps analysis to look at how we were prepared for not just pandemics, but disasters in general. And then it basically got us to the point where we had 300 plus people at the conference where we could talk and not in real time create relationships with folks that we had been working with in emergency management and the Department of Health as well. So that turned out to be really beneficial. Of course, I can't think of any better way to spend CARES Act dollars right now than to do whatever you're allowed to do in your state to keep people out of institutions where it's risking their life just to be there. So that's something that we're going to continue to look at. Again, another area where our Department of Health has come across money that we did not have, that was their CARES Act dollars to help with that. So looking at the first dollar resources and not duplicating services, those types of things. Unfortunately, a lot of that money was supposed to be spent by the end of the year. That's likely not going to happen. I don't know how much of it will get rolled into this next stimulus package, but it's going to be up to us. We have an obligation to raise our hand and let them know that human life is probably more of a priority than some of the other things that they're concerned about. But again, if anybody wants any information about the workshops, the trainings, and the conference, I'm happy to share that with you. And we have daily phone calls nationwide at 3 p.m. Eastern that have to do with dealing with independent living and disability rights during COVID-19.
Wonderful. Todd, if you could drop any information like the website in the chat, that would be great. Kimberly Mack, did you have a thought?
This is Kimberly Mack from Alliance of People with Disabilities. We are in Seattle, Washington. And one of the things that we have actually used our COVID dollars for is early on, we realized that the county was not including people with disabilities in a lot of their outreach and messaging. And so it was inaccessible for the disability community in order to get that information, food resources, housing, funding, anything like that. And so in response to that, I partnered with the executive director from the ARC of King County, and she and I have been working diligently together since March. We have formed a coalition of disability service providers in King County in order to advocate for the county to provide access to all of their materials, up to and including actually collecting disability information, which they don't do at this point. And so our county operates under what's called, it's our strategic plan, and it's called the Equity and Social Justice Strategic Plan. And that strategic plan has no inclusion of people with disabilities in any way, shape, or form. And so through the advocacy that our disability consortium created, we actually wrote a letter to our county, and it resulted in a fairly lengthy 17-page report on the failures of our county for the disability community. And because of all of the outreach, we actually have been written into the budget. They are hiring 2 new ADA coordinators. They are doing a bunch of equity work. They're re-examining all of their Title I and Title II work within our county to ensure full disability equity and inclusion. The reason that we formed our coalition was because in King County, where we are, there are coalitions for everything, from food service to housing to kids daycare, but there was no coalition for the disability service providers. We were obviously finding that we were all kind of working in silos, and it's through the community action that we have worked together to provide an opportunity to have those disability service providers come together and talk about all of the shared issues that we're having, as well as to share resources. And so not only is it a place that we can have for advocacy to work with different organizations and departments and the county in general, but it also is a place that we know that the county can send us resources, and we can send it out to our disability service providers mailing list in order to be able to share that. And we're hoping that, I mean, it's already provided additional referrals to us as an IL center. Initially, you know, it was quite a bit at the beginning, and it's kind of tapered off a bit right now because we're doing obviously more advocacy work on that end. But the relationships that we're building that we never had within our county with some of the smaller service providers is just absolutely amazing. And so I just encourage you, if you can find a way to, if you don't already have something like that, if you can find a way to partner with one organization or two to try and link the disability service providers within your county or your service area together. Many voices make a lot of difference when it comes to advocacy and seeking things that can better the situation.
Thanks, Kimberly. My gosh, you guys, time flies, y'all. So we've covered so much today, but I was wondering if there were any kinds of questions that hadn't really gotten addressed yet that anybody would like to ask at this point, or any other information we should know.
Hey, Mary, one thing one of our siblings in Montana was kind enough to share with us some information they got from the Walgreens rollout of the vaccine that's going to be happening there. There's quite a bit of information there, and I doubt I'm really supposed to share it, but looking at their plans for nursing homes and how they're going to do it, I'm hoping to put together a short synopsis. So if I can get that to you and you can get that out to the rest of the group at some point, I'm happy to do that.
Thanks, Todd. I'd love to do that.
Yeah, I would like to add if I can, Wally. I see one of our individuals that was on the chat asked if this meeting will go at least every month. If you guys can, and I agree, if you can do this at least once a month, so we can come together and share ideas and talk about the weather, whatever it takes. You know, I would like to do this every month, and I thank you very much for the invitation.
Great. Well, so I guess this would be a good time to say that, yes, so this is, sponsored by April, today's call. We know that it's important. And so we've actually, working with the ILNet, or the ILRU Technical Assistance Center. And in January, we're going to start holding these every third Wednesday of the month throughout the rest of the year. It's you'll see it across your board as the Rural Conversation Community. You know, they used to be about all kinds of things, but right now they're just really about COVID, because it's just kind of taking all of our lives over, I think. So we're going to do that with the ILRU Technical Assistance Center every third Wednesday of the month. And I saw Kimberly said every other week would be good. And so, April, again, we're going to look at, other ways that we can continue conversations through our funds as well, like today's. So maybe you'll start seeing, 2 a month. We're kind of open to following where the need is. But thank you for saying that. And we're glad that these are useful. And with that, we've got about 3 minutes left. And I'm wondering, if there's anything else that we really didn't address. I had a couple of questions earlier. Are there any folks still struggling with getting PPE or, needing immediate assistance for consumers?
This is Diana Clanton with the Sedan Skill again, and I think that's what our Skill did. They did that CARE Act money, and we have got loads and loads of the PPE. And we also just had the other day, our emergency prepared man brought around hand sanitizer to give out. And then our health department gave us a few things to give out also. So we could keep our customers and their workers safe.
Mary, another thing that I learned from the state of Florida, they had purchased some steam cleaning equipment for all of their sills down there that they can use to reuse durable medical equipment and assistive technology that is okay to do. I know there's restrictions depending on where you're at, but we also use it in our office. I'll try and get that the manufacturer information over to you. The other big one I haven't checked on the price of, I'm sure it's pretty expensive, is the hub scrub hub or hub scrub. There's 2 of them, but one of them is specifically designed to clean large durable medical equipment and decontaminate it completely. And the atomizers for our offices and living spaces to be able to sterilize where we're at, and air purifying systems. CARES Act funding did help us with that.
I know we're at the end, but this is Kimberly from Alliance of People with Disabilities again. I just wanted to point out, you guys, those of you who have PPE, who haven't even considered it, there's been a lot of conversation about reaching out to the deaf and hard of hearing population. Don't ignore getting those face coverings that have the clear panel. They are essential for communication for individuals who are deaf and hard of hearing, who lip read. So if you have, those are really pricey. So if you need to spend money on CARES Act money, get some of those. They are absolutely wonderful. We bought them for all of our consortium members, and they hadn't found a resource to get them, and they couldn't afford them. And with all of the CARES Act money that we have, we were able to help provide for our providers who serve the deaf and hard of hearing population.
Thanks, Kimberly. Great thought to end on today. I can't believe it's noon already. Again, I really appreciate everybody's willingness to share everything. We are going to go ahead and save the chats, and we'll send out all of this information. I'm hoping to get it pulled together in the next couple of days, and I'll have that come out on the April listserv as well as the ILRU listserv again. Thank you all, and thanks for the amazing work that you're doing. I also wanted to mention Misty did send me all those emails for some of the nursing home location stuff, so I'll add that in. Thanks, everybody.
Thank you very much. Bye-bye.
Season's greetings. Happy holidays.
Happy holidays.
Take care.